Thank you very much, and it's my pleasure to be here and summarize a little bit the 5 priority areas that the World Health Organization has in our support here in Uzbekistan for the year 2015. First of all, I would like to mention the prevention and control of non-communicable diseases, which make up a majority of the diseases and the death here in country and in the region. And I would like to mention the importance of us all in the UN family to support the government in finalizing and implementing its first national strategic framework and action plan to combat these major diseases, including heart disease, lung disease, cancers, and diabetes, but also to tackle the important risk factors for non-communicable diseases, such as tobacco, alcohol, physical inactivity, and unhealthy diet. One of our main contributions in this is the publication of recent national surveys that have been done for the first time in this country. For example, the National Global Youth Tobacco Survey and also the Risk Factor Surveys for Non-Communicable Diseases, or STAP surveys, both of which will be fully published hopefully this year here in country. The second area I would like to mention is our ongoing fight against so-called communicable diseases, and I'm thinking especially of tuberculosis, of course, of HIV/AIDS, but also of other diseases, including vaccine-preventable diseases. It's worth mentioning that I think great achievements have been made in this country in controlling diseases that are preventable by vaccines and by spreading vaccination programs across the nation. However, new vaccines are also being introduced, and we are supporting the government very much also in the wide dissemination of new vaccines, for example, rotavirus against diarrhea, human papillomavirus vaccine, pneumococcal, lung disease vaccines, and other vaccines that have just become available in this country. That is very important work. I should also mention our ongoing efforts in supporting all partners in this country to fight the multi-drug resistant and extremely drug resistant variants of tuberculosis, which is a very hard struggle for any country and a very important one to pursue this year. The third area I would like to mention is so-called the improving the health through the life course. In other words, addressing age-specific health needs, for example, needs of young people, needs of infants and mothers, the broader area of reproductive health, nutrition, but also issues related to health of the elderly within the year of the elderly in Uzbekistan 2015. And this area also includes our support to the environmental health sector, which is a very important sector, especially in the western part of this country, of course. So in that area, I would like to mention again the very strong leadership that this country has in strengthening maternal and child health and achieving the Millennium Development Goals. Lots have been done, but more needs to be done in some areas, and we stand ready to support the government in this area too. The fourth area and priority area of work this year is called health systems strengthening, because we cannot fight diseases and have effective health interventions in the country without strengthening the so-called building blocks of the system, which includes very much health policy and planning, the financing of the health system, the information systems, human resources, and service delivery. Here we're very happy that the government of Uzbekistan is in the final stages of agreeing on its first umbrella health strategic framework called Health 2020, which will serve as an overall umbrella to the already existing subsectoral strategies on, for example, non-communicable diseases, maternal and child health, immunization, infectious diseases, and others. Important work has already been started last year on it, and we're hopeful that the new Health 2020 National State Program and Action Plan will be finalized this year with support of many of the partners here. Finally, I would like to mention the important priority of strengthening preparedness and response to disease outbreaks, but also other natural calamities such as earthquakes and droughts, for example, that may affect the country. From the health-specific side, it is worth mentioning that the country is working towards becoming fully compliant with the universal international health regulations that oblige most countries in the world, if not all now, to notify diseases and to be ready for potential disease outbreaks. This, for example, includes keeping the country polio-free and safeguarding the country against outbreaks in other countries. We have had many examples over the last few years in Asia, for example, bird flu, swine flu, SARS, but we're also all aware of the global threat of even hemorrhagic fevers such as Ebola these days. And we are trying very much and will continue our efforts to support the government in being fully compliant with the international health regulations and saving the country from being affected from those outbreaks. Thank you very much.